verification on the Oregon Medicaid provider web portal. So this is where you would verify eligibility for Oregon Health Plan enrollment. So I'm logged into the provider web portal here, and what I'm going to do is I'm going to click on the eligibility menu. And here's my eligibility verification request screen. This is where I enter information about a person to see if they are a current client on the Oregon Health Plan. So you have to enter a combination of information on this request screen and then click on the search button to find that person. So if at any time you're on this screen and you're not really sure what you need to enter, or you're not sure you have the right combination of information to pull up that person, if you leave everything blank and you just click on the search button, the system is going to tell you exactly what it needs to find a person in the system. So you'll see there's different combinations to find a specific client. And then, of course, you always need a from date of service and a to date of service. So I'm going to go ahead with a client ID and birth date. I have a couple different examples here, one that has coordinated care. I have another one to show you that has third-party liability. So we'll get to that. And then I'm just going to enter the month of January 2014 here. So the from and to date, it can be one day, so it can be the same date. It cannot be any later than the current date, so it has to be through today or before. But it can be also a date range. Your date range can be up to 13 months in length, as long as you don't try and look at a future date. You should be good with that. Now you have to be a little bit careful when you do put in a date range, because the information that you're going to see on the date range is any information within that range. So let me go ahead and click on search over here and I'll show you what I mean. Because sometimes when you have multiple dates, you just have to pay a little closer attention, because sometimes the plans change or third-party liability may drop off for a couple of days. There may be lapses in coverage, that type of thing. So always make sure that you're looking at your dates very closely on the eligibility file when you search for a date range. So here's our file. And you'll see the top section is just basic client information. If the client had Medicare coverage, you would see effective and end dates under the appropriate type of coverage. I'm going to move on down to the benefit plan. This is where you'll see the enrollment for that client. So you'll see this person has OHP Plus. Most of the time, you also see contract nursing and mental health services plans. And then there's that effective and end date. So I searched for January of 2014, and what you'll see is this person was eligible for that entire span of time. If there had been a lapse in coverage, it is possible that one of these dates would be different than what you searched for. For example, let's say that this person's coverage didn't start until January 9th. Then you would see an effective date of January 9th and an end date of January 31st, again, because it's only going to show you information within the date range that you searched. So pay attention to that kind of stuff. The next section is service type, coverage, and copay. This is where you can see, according to a specific benefit plan that a person has, what service types are covered and whether or not they have a copay for those services. Now, what you'll do is you'll click on their basic benefit plan, which in this case is the OHP Plus. And then you'll see those service types and whether or not there's active coverage. You can see dental care has limitations on this one. And then whether or not there's a copay. So there's a copay of $3. You can see the line that I'm looking at right now for chiropractic coverage, but the coverage is active. Okay, so that's what you're going to see in here. Now, if you want more information about the limitations, you can, excuse me, look in the rules for that specific service, and even in the general rule book of the Oregon Administrative Rules to find out what those limitations are. So there are dental and vision limitations for non-pregnant adults. So that's why you're seeing limitations there. So let's go ahead and move down the eligibility file a little bit here. And what you'll see is TPL. TPL stands for third-party liability. That's if a person has private insurance. So if the person has private insurance and has been reported to their caseworker and we're aware of it here at Oregon Health Plan, it should be entered on that row there. And I do have an example of that. I'll show you that next. Next is managed care. So under managed care, this is where you're going to see which coordinated care organization, if any, that a client is enrolled in. So what that means is this client is enrolled in a specific plan that handles prior authorization and billing for this client. So they basically manage the care for this client. So you'll see this person is enrolled in Willamette Valley Community Health. And then what you'll see is that provider phone number in case you need to reach them. You'll see the plan type. In this case, it is a CCOA. And then the effective and end date of that enrollment. Again, pay attention to those dates, because it is possible, again, that maybe we searched for the entire month of January, but it's possible that they were not enrolled in that organization for that entire time. So make sure you pay attention to those dates. Next, we have lock-in, and this is if a client is locked into a specific pharmacy, and you'll see that pharmacy information there. I have another example where we have lock-in as well, so I'll show you that in just a moment here. And then our last section on the eligibility file is service limitations. Now, if on the panel at the top, when you're doing your search, if you enter a procedure code, there is a field where you can enter a procedure code up there. And if you do that before you click on search, then the service limitations section is going to tell you whether or not there are limitations for that specific procedure. Okay, let's go ahead and look at a client that has third-party liability. So I'm just going to make a couple of changes up here and look up a different client. Just going to keep our dates the same. And here's our next client here. And then what you'll see, a lot of the information looks the same. But then what you'll see is if we get right down here to the TPL section, third-party liability, you can see that this person has medical coverage through another carrier. So right here you'll see BCVS of Oregon, that's Blue Cross Blue Shield of Oregon. You'll see a policy number, the policy holder, the type of coverage. So this is major medical, including maternity. And then you'll see effective and end dates within the range, again, that we searched for. The only other thing I'm going to point out on this eligibility file, now that we see the third-party liability, is under managed care, this plan type is a little bit different. We do have some areas that are not completely up with coordinated care organizations yet, so sometimes you might see a different type of plan. And this one here is DCO, and that's a dental care organization. So this person's dental care would be covered through that plan, and you would contact that plan for any dental services there. So I just wanted to point that out. And then one other file I do want to show you so that you can see an example of lock-in. So I'm just going to change some information up here again. And search by different information as well. Okay, so here is another client. So on this one, there's a couple of different things that I'll point out. If you look at the benefit plan section, you can see this person has BMH, that's the OHP plus that we saw on the other two. But this person also has BMP. And if you'll remember, I talked about non-pregnant adults have limited coverage for dental and vision services. So what BMP does is it's an additional benefit plan that we add for a pregnant adult. So that indicates that this person is pregnant. And if we click on that plan, we will see the dental care and vision fully active for that member because they are pregnant. They have the BMP benefit plan. And then I'm going to scroll down just a little bit so we can take a look at that lock-in information. So here, this client is locked into a specific pharmacy, and you'll be able to see that information here. So the lock-in plan, that's just under the benefit plan that they have, the effective and end date within your date range, and then you'll see the provider name, and usually you'll see a valid provider phone number there as well. So that's how you can see lock-in. All right, and that is eligibility on the Oregon Medicaid provider